In some ways I see it almost as behaviour modification surgery. We try and impart as much information as we reasonably can to our patients about what their experience is going to be like. We try and describe the post-operative journey. I like to think all our patients go in well informed about what they're getting themselves in for.
Our patients stay in hospital for 2 nights. Usually they don't have any kind of special attachments and we get them going pretty much straight away. So surgery perhaps in the morning, up and around in the afternoon, walking, starting to drink. 2 nights in hospital, the next day is just really drinking and walking and doing some breathing exercises, and usually patients will go home on the morning of the second day. I usually tell people to take 2 weeks off work. One of them is to physically recover from the operation. The surgery itself is not a big painful experience. It's done through keyhole incisions, and by about the 3rd or 4th day post-operatively, most patients will just be taking paracetamol and maybe anti-inflammatory like ibuprofen. And often they're very surprised about how good they feel or how quickly they're able to return to normal. So many of them would be driving by the 3rd post-operative day, by the weekend after surgery, doing things that they would normally do around the house like shopping, taking kids to sport. The second week is for their psychological recovery. So I think that adjustment is a really big thing, and it's good to have some headspace to get your head around the fact that you're going to need to drink every 10 or 15 minutes.
So it's 2 or 3 tablespoons of food per meal, and it's regular sipping of water so you get adequate volume in. We're still asking for 1.5 litres of liquid in per day. But it's very important to realise that this is a process in evolution. What you experience at 2 weeks post-operative and 4 weeks post-operative is going to be quite different from where you are at 3 months or 12 months down the line. By 12 months, I'd expect you to be eating at least entree-sized meals for your meal, in addition to drinking really what you feel you need to at any given time. That really emphasises why surgery is a tool. Surgery works very effectively for inducing weight loss, but it's critical to maintain the lifestyle choices that you learn as you readapt to your new eating behaviour so that you don't get weight regain afterwards. By the time you get a certain amount out from surgery, if you choose very calorie-rich, calorie-dense foods, then you can start to get weight regain. So sticking to the lifestyle advice is critical for a good long-term durable outcome. The time to get to those successful results, those people who are going to lose a significant portion of their excess weight, hopefully 70% plus, those who are going to see an improvement or even hopefully remission of their diabetes, that's going to happen over a period of time. I'd be starting to be interested about where we're heading to in a long-term result by the time we get to around about the 12-month mark, and I'd still be intimately involved in their ongoing care at that stage. And I find even those who have a more difficult time in the first few weeks and think, wow, this is such a big change, I'm not sure I like where this is going, by the 12-month mark they're going, look at this journey, it's been difficult, but I'm so pleased I got to this destination. And I counsel a lot of people that first 12 months post-surgery is going to be 12 months that the future you is going to thank you for a very long time.